Subcutaneous injections involve placing medications into the loose connective tissue under the dermis. As part of infection control, you must perform hand hygiene. Adhere to the 5 moments of hand hygiene in order to reduce the transmission of microorganisms. As part of maintaining a therapeutic relationship, make sure that you introduce yourself, explain the procedure to the patient, and gain consent. At this point, make sure that you also explain to the patient potential side effects of the medications. When confirming patient identity, ask the patient to state their full name and date of birth. Use the medication chart and the patient armband to confirm full name, date of birth, and medical record number. Confirm that the prescription is legal and valid. Perform the first check of the 5 rights, comparing product to prescription. Preparing the injection, collect the appropriate equipment. This syringe has a subcutaneous needle already attached. Because it's already attached, we're going to use this to draw up the medication from the glass vial. Here I have the glass vial with the medication in there and an alcohol swab to clean the patient's skin before injection. The reason why I have 2 kidney dishes here is one is for the rubbish and the other is for specifically the sharps, which then have to be discarded into a sharps bin after the procedure is finished. Before you draw up the medication from the glass vial, tap the ampule to move the fluid down the neck. To protect the nurse's fingers from trauma as the glass tip is broken off, use a small gauze pad around the neck of the ampule, or I use the alcohol swab packet. Aspirate the medication into the syringe by gently pulling back on the plunger. Withdrawal of the plunger creates negative pressure within the syringe barrel, which pulls the fluid into the syringe. Expel excess air bubbles. Remove the needle from the ampule. Hold the syringe with the needle pointing up. Tap the side of the syringe to cause bubbles to rise towards the needle. Draw back slightly on the plunger and then push the plunger upwards to eject air. Do not eject medication unless it is excess medication to what has been prescribed for the patient. Perform your second check of the 5 rights with a second nurse. All medications that are injections must be checked by a second nurse. Upon entering the patient's bed space, remember to perform hand hygiene. You can now perform the third check of the medications. This third check must be performed at the patient bedside, and a patient identity check must be performed at this point. Full name, date of birth, medical record number, comparing the patient's verbal response, the medication chart, and the patient's armband. Select the appropriate injection site. The site most commonly used for subcutaneous injections is the abdomen. Clean the site with an antiseptic swab. Apply the swab at the center of the site and rotate outwards in a circular direction for about 5 centimeters. I leave the alcohol swab there, pointing at the site where I have cleaned. Remove the needle cap from the needle by pulling it straight off. Hold the syringe between your thumb and forefinger of your dominant hand. Inject the needle quickly and firmly at a 45 to 90 degree angle. Place the exposed sharp straight into the kidney dish with the broken glass vial. A patient's body weight indicates the depth of the subcutaneous layer. Generally, a 25 gauge 26 mm needle inserted at a 45 degree angle or a 13 mm needle injected at a 90 degree angle deposits medication into the subcutaneous tissue. If the patient is obese, pinch the tissue and use a needle that is long enough to insert through fatty tissue at the base of the skin fold. Conclude the interaction with the patient. Leave them comfortable and reassured. Perform hand hygiene. Dispose of all equipment and rubbish. All sharps must be disposed of in the sharps container. Complete the accurate documentation.